Joining us right now is Dr. Payal Adhikari, a pediatrician with Child and Adolescent Health Associates in Chicago. Thanks again for joining us. So does this mean children in this age group can get vaccinations immediately today?
As of now, yes. Yeah, it looks like when the director of the CDC announced this yesterday, there were already kids in Connecticut live streaming getting their vaccines. So absolutely. I did look on vaccines.gov, which is supposed to be the centralized system for kids to get their vaccines. And it does not look like they have the age 5 and up group on there yet, but hopefully very soon.
I wanted to ask you, should parents talk to their pediatrician before they get the vaccine, or with the CDC's recommendation that basically means it's a go?
It's a go. Yeah. I mean, a lot of pediatrician offices will have the vaccine. So if that's most convenient for you, go for it. There's also a lot of schools that are going to be running clinics as well. So I would go to the most convenient option for you as a parent.
What about side effects? Are we looking at, I mean, this is a much lower dose than the adult version of the vaccine, but are we looking at the same kinds of side effects as grown-ups?
Yes, the most common side effect will be soreness at the injection site, which is common for any vaccine. The other side effects, such as fever, fatigue, those things can also happen similarly to adults.
I do have to ask a question for those parents who are hesitant about this. We have 28 million children who are eligible for this vaccine. We've probably had fewer than 10,000 hospitalizations due to COVID and fewer than 100 deaths. What is the number one concern of the CDC and doctors for making sure that children are immunized against coronavirus at this point?
Any kid who gets sick or dies is one kid who gets sick or dies.
Yeah.
So I think that is, we can't discount, and I think the numbers are actually a little higher than 100, but we cannot discount the number of people under 18 that have been hospitalized, which is in the thousands, and then the people who've died that are in the hundreds. And not only that, but we don't know what the long-term side effects of COVID are. So even if a kid gets COVID and it's a mild case, we don't know long-term what that could do to their health. So it's super important for them to get it to protect themselves, also to continue to prevent the spread to other people who can't get vaccinated. So grown-ups, who are immunocompromised, grandparents, people like that, kids are vectors for coronavirus. So it's very important for them to also be there to prevent the spread to other people.
And I was reading in an article that for a lot of people, it's the mental health aspect. It's the comfort of knowing that, okay, I received the vaccination. So for children, I mean, you yourself as a pediatrician, are you hearing the worries of kids who are just saying, I just want to get the shot because they know that they'll have peace of mind?
Absolutely. When the 12 and up shot came out, I remember the kids would come into my office just gleeful to tell me that they had gotten the vaccine. And even though they're still wearing masks and they're still being careful in their social lives, they just sense relief that they feel protected against this disease. And so I absolutely see it. I have a 5-year-old, and he has been every day telling me, I'm going to get the vaccine tomorrow. So, at that young age, they really feel like it's such a good thing. So yeah, absolutely. I think their kids are going to be much more comfortable in social environments once they've been vaccinated.
All right, Dr. Adhikari, thank you so much. It's always nice to hear from a doctor and a mom. We appreciate it.
Thank you so much.
Thank you. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.